Don't be a boob. For more videos like this one, please subscribe to this channel.
Today and all the way through today, where there's not much, we're excited about everything else and all the NBA and the college hoops. But what happened with Tiger yesterday, one of those days you remember where you were. And of course, Matt Bear, you were here 2 hours of nonstop live coverage immediately after it happened.
Yeah, the words you're using today, glad that he's alive.
Yeah.
Still, it's awful and sad that a player that's been through so much is now going through more life's adversity as we continue to coverage the aftermath.
Let's keep the medical aspect of this going right now and bring in our licensed physical therapist and injury analyst. That's Stephania Bell. And Stephania, we just saw in detail the doctor's statements regarding Tiger's injuries. Break that down for us. And what's your biggest takeaway from what the doctors that are dealing with Tiger said?
There are a lot of words in there that give you insight into just how serious this injury was, starting with the fact that he had comminuted open fractures. Comminuted means fragments. So the bones, when they shatter from a high energy impact, like was the case here, can break into multiple pieces. So comminuted and open means that it punctured the skin. They inserted a rod into the tibia, that's the large shin bone, to help stabilize the fracture. And by repositioning the fragments, this is part of what takes so long in surgery, they're hoping that they'll get optimal healing of the bone. They also mentioned pins and screws in the foot and ankle, so you know there was additional injury down low, the extent of which is not totally clear. They talked about doing release of the tissue coverings of the muscles. You have compartments of muscles in the lower leg, and they're covered by thin tissue called fascia. And if there's swelling, which there always is with these type of injuries, it can cause compression, and between the muscles, there are nerves and blood vessels, and if you get too much pressure, you can cut off the supply, and that can lead to tissue death. So they do a release of that tissue to remove the swelling and hopefully allow that tissue to heal. You heard Jean mention they may have to go back and do additional procedures to continue to alleviate that swelling pressure. That's all part of the process going forward.
Gosh, Stephania, there are just so many layers here and still so many things that we don't know. So short term, the very first steps to Tiger's recovery would be what?
Again, infection, preventing infection is the #1 concern at the top. And it's part of why when you go to surgery, they are cleaning out the wound, they're irrigating it, they get the patient on IV antibiotics typically right away to help counter the risk of infection. But of course, you picture the car accident scene. When you have an open wound, there's a lot of debris that can potentially get in there. So they're always watching for signs of infection, redness, warmth. Does the patient develop a fever? Those are the initial concerns. And then controlling the swelling and managing pain. And that's really the focus at the top.
Again, so much that we don't know, but one thing that we do know is that Tiger has a notoriously bad back. He just had his 5th surgery on it about a month ago. So add that to the serious injuries that he sustained yesterday, Stephania. And again, it's speculation right now because we just don't know the full extent of his injuries. But when you take all that we do know from what the doctor said and add in the significant back injuries that he continues to have, what do you say? How much more concerned are you based on that?
Well, I think, it's hard to project. Again, as you said, we don't know. And in addition to his spine, so he has had multiple spine surgeries, one relatively recently. He's had a fusion in his lower back, and clearly a rollover and impact collision isn't helpful. But the other thing is the statement really reflects where the priorities were. We don't know if there were additional injuries. When you have an impact of that kind, you can get bruising and swelling all over the body, even if there's nothing to repair with surgery. So the total body inflammation can take quite some time. We don't know what his weight-bearing status will be as he moves forward. We don't know if he'll require additional procedures, other surgeries beyond what he's had. So again, those are the things that make a timeline really difficult because there's just so much detail that has yet to be uncovered.
Stephania, you were on the forefront of the coverage involving Washington football team quarterback Alex Smith and his recovery from 17 surgeries. I've heard a lot of talk about his name coming up a lot because of the number of breaks he had. That seems somewhat similar to Tiger, at least from the outside. From what you know, how similar are Alex's injuries to the ones that Tiger suffered? Is there any comparison that you can make and give us more perspective?
It's understandable that people want to go there, you know, two high-level athletes with serious injuries to their lower leg. But beyond that, we really can't make a comparison. Trauma is highly different from one individual to the next. And if you think about it, Alex had a rotational or a torsional injury on the football field. He dealt with a large spiral fracture. The fracture was like a corkscrew up his shin. Tiger had a compression type injury from a high impact. It's very, very different.
Okay.
Both of them had soft tissue injuries, but Alex dealt with infection, and we saw the complications of that. And what that should tell us is why it's such a concern, and everybody's watching Tiger and hoping that they're able to stave off an infection.
Exactly. That was really the reason why Alex Smith's life was in jeopardy, and all prayers and thoughts are going to Tiger as well as the medical team that's working on him around the clock. Stephania Bell, thank you for your insight here on SportsCenter.
I think one of the things about Tiger Woods is we've said this often, a transcendent athlete. And what Tiger has done for the game of golf is he's taken people that aren't golf fans and brought them into the sport because he made the sport cool, which is why we're getting so much reaction from everyone around the world.
It completely changed the game of golf, obviously, but I think completely changed sport as a whole. That's why reaction came globally from athletes in every sport, and of course that includes many people here at ESPN, our commentators, and one Stephen A. Smith. Here's what he had to say. First take, last take.